The Susan and Richard Kiphart Center for Global Health and Social Development is a new initiative at the Crown Family School that I hope will have serious and lasting impact.
The Kiphart Center brings together teams from around the university and our partner communities to address and promote community health and well-being around the world. The center is part of an ambitious vision to harness the broad interdisciplinary teams here at the university to apply its talents, energy, and power to shape the policies and structural inequities that affect health and to make real impact.
The Susan and Richard Kiphart Center for Global Health and Social Development is going to be transformative.
Well, I have known Susan and Dick Kiphart for a number of years, and I was introduced to them because of their interest in global health. And what was really striking about them is how they were turned on to the potential impacts of global health interventions. You know, simple things like lack of access to clean running water, the lack of access to healthcare, lack of access to healthy foods.
The Kipharts want to endow studies in global health, where students will make the University of Chicago the destination to come and study in an interdisciplinary and interprofessional manner. And that's why I'm excited about the future. Our students are bright, our students are innovative, our students want to save the planet.
So the Kiphart Center for Global Health and Social Development builds on the work of the existing Center for Global Health with the intent to broaden the scope, to think well beyond biomedical responses to global health inequities, to think more broadly about issues of well-being, and to focus on the social determinants of health.
We have a Center for Global Health in the Biological Sciences Division. We have a pre-existing set of programs around global social development and practice here at the Crown Family School. And sort of taking both of those arms, both of those sort of pillars, and uniting them under this one center can really sort of drive a vision for progress in those two fields that I think hasn't been as achievable and hopefully will be something that can be moved forward by the Kiphart Center itself.
The big challenges for global health are the disparities in access to care and the opportunity for collaboration between the Crown Family School, the medical school, or why the Kiphart Center has the opportunity to make such a significant difference, to develop the cadre of next generation leadership that will provide us with public policy that will ensure that we can deliver outcomes that are sustainable and durable.
The Kiphart Center can facilitate the multidisciplinary understanding of health and social development in the sense that it is situated in a school that is very much focused on a very interdisciplinary approach. And by leveraging these knowledges and expertise on global social development, we can also help understand global health in a more sophisticated way.
Susan and Richard Kiphart Center for Global Health and Social Development will contribute to the development of cohort after cohort of scholars, policymakers, social workers, right, who are contributing to a more equitable distribution of resources that support the well-being of people around the world.
So thinking about the next 5 or 10 years in the Kiphart Center, again, first and foremost, I see that intellectual contribution driving things, being a hub, setting the agenda for scholarly work in global health and in social development, as well as their intersection, and making that intersection really something productive, something more than just either of the two fields on their own.